Hi, welcome. Thank you to those who are joining. Thank you to those watching live on the web, and thank you to my replay viewers. I hope you guys are doing well today. So this is the time that I get on. Welcome to those that just joined. This is the time that I get on and I do my nurses scope. For those who are in nursing, hey Garth, how are you? For those who are pursuing nursing or thinking about nursing or in nursing school or just finished, this is when I do my nursing scopes. So let me introduce myself in case you don't know who I am. So hi, my name is Choma. I am a registered nurse. I've been a nurse now for 6 years, and my background is in medical, surgical, and telemetry nursing. I'm the founder of Choosing Nursing over at choosenursing.net, where we help you to successfully transition into the nursing field. So today I'm going to be talking about 2 nursing student jobs that you need to know about. And jobs, I kind of use that word loosely, but these are 2 types of positions that you should know about. And I'm going to talk about the pros and cons between the 2, what you should be conscious of during this time while you're in nursing school. So I'm going to be talking about that right now. And so the first one of them is a job, a paid position, and the other one isn't. But I will tell you what you need to take into a factor. So if you want to follow along, if you are in a position to, watch this on your computer or your phone, another phone, whatever device, it's on the website, and the website is called choosenursing.net. And the name of the article is called 2 Nursing Student Jobs That You Need to Know About. So, and this is if you want to, follow along or read it later, because the article, of course, in there's a whole lot more detail than what I'm going to say via the video. But I also give some my own, experience as well. So two nursing students, and it has a visual as well, so you can see the visual as opposed to just the article itself. So the first one, and things may have changed since I last went to school, but this is how I've known it to be when it comes to being in nursing school. And this is what you want to know if you are in nursing school, if you're about to start nursing school, or if you're close to the end. If you already finished, then this is not going to be relevant for you, but it's more so relevant to those who are in nursing school or those who are getting ready to start nursing school. Okay, so the first one, what I'll do, I'll say what they are called, and then I'll break down the pros and the cons. And the titles may have changed since I've last been through it, but for me, this is what I know to be true. So the first type is a nursing preceptorship versus a student nurse intern position. And then there's also a nursing assistant, which I'll talk a little bit about. But I'll go into detail more so with these positions. So nursing preceptorship, right, versus a student nurse extern or student nurse intern position. So first let me talk about what it means. So nursing preceptorship, and the thing about the nursing preceptorship is not always available to every individual. There are some hospitals that still, I haven't seen any job openings recently, but there are some hospitals that if you are in your last semester of nursing school, they offer a position, it's not paid, a nursing preceptorship position where you can literally be just precept and you are with a nurse and everything. Some hospitals, not too many, offer this. Also programs, there are also nursing programs that offer a nursing preceptorship option as well. Nursing, it's incorporated in the program. The difference with a nursing preceptorship is that it's not paid. You don't get paid most times. You don't get paid because why? You don't have a license. So you're not getting paid, but however, the experience is valuable because you're getting experience. And you have an advantage that most nurses don't have, I should say most student nurses don't have during this time when they're preparing for nursing school. Especially you want to be at an advantage. You really do want to be at an advantage because there are a number of nurses that are applying for positions. It's not easy. It's not typically easy for a new nurse to get a job depending on the state or the area, but you want to have this advantage. The difference between a nursing preceptorship too is that there's more independence. I shouldn't say independence, but it's more closely related to what you're going to do as a nurse. You see more, and then the amount of time that you spend is longer. So for example, with clinicals, when you're doing clinicals, you're usually there, what, like 6 hours, and then you go home. I know some teachers, like, they do the whole 12 hours, rarely though, but the nursing preceptorship, you're actually there for a whole 12-hour shift. So you see the beginning and the end, and you see what it really is like to be a nurse. And you actually, give medications with the nurse. So you get more, you see more of the role, and that's the reason why it's also more of an advantage. Jobs look at you more as opposed to other positions. They see you as a commodity, and really it is so easy. I'm sorry, I shouldn't say easy, but it's incredibly more easy to get a job with a nursing position. Nursing preceptorship position, as opposed to someone who doesn't have one. You just look very, very marketable. So if you ever come across this, take advantage of it. Some programs, like I said, they incorporate it in the program. Like for one, I didn't go to this school, but there was one college. It was actually a community college, and they have a nursing preceptorship in their program. And the thing about their program too is that you have to actually come on your off day. Like you have to actually come like when you're not with the instructor. That's the difference. You come when you come, and then you have a nurse that you're assigned to. And I know this because I was the one precepting the students. So you come on a day that you pick, that's assigned to your nurse, right? And then you actually give meds, you actually do procedures, and you're there from the time that the nurse starts and finishes. And then that nurse also grades you. And then your instructor will also tell you how you did, but then your instructor's not going to be there with you like 24/7. Sometimes they'll come in and check with you once a day or whatever, but you really see everything. But like I said, it's not paid, but it looks exceptional on your resume, and you have an advantage, and it really teaches you what it's like to take care of patients. Because like I said, nursing school doesn't really teach you a whole lot about the reality of nursing. So that's one thing that's good about it. And then if you have the option, and this is also too, when you're searching programs, if you can find something that includes that, go for that program. Chances are the program probably has a waiting list too, because it's just so attractive, but I really recommend it. Then the other option is a student nurse intern. So student nurse intern is usually a paid position in a hospital setting. So the difference with the student nurse intern though is that you don't do the same role as a nursing preceptorship. You don't really, like, you do more vital signs, you do more nursing assistant duties. That's the difference. You're not walking around with the nurse giving medications. You're not aware of like why procedures are being done. You're not doing the holistic picture, but you are getting paid for your role, for what you're doing. That's one thing that's good about it, is that you're making money, right? And you're making more money than somebody that's just working a minimum wage job, right? And so so for nursing students, it looks more lucrative. The other thing too about it is that it helps you get your foot in the door, right? That's the difference, because see, a nursing preceptorship, you do the preceptorship, but you don't necessarily have a job. Like once it's over, right? But however, like I said, you look more marketable. So when you do apply, you have a very good chance of getting a position. Student nurse intern means that you have a job. Like you work there, you're paid to work there. And then when there is a position open that's available for a new grad, you're going to be, as long as you are a good employee, you will be the first person that they look at. And then you've already built a relationship with the manager because you've been working there. But like I said, you do more duties of a CNA. Like, you do hygiene, you clean them up. That's the difference. You don't give medications as a student nurse intern. You really don't. At least from the positions that I've seen. You don't give medications, you don't write orders, you don't call the doctor. These are all things that nursing preceptorship does. You don't call the doctor to see what's going on with the patient. No. But student nurse intern, the difference, like I said, is that you get paid. And then you have your foot in the door because you're already working there. You've already developed a relationship with the manager, but however, you're not doing the duties of a nurse. You're not seeing the real picture of what a registered nurse does or licensed practical nurse does. But however, like I said, it exposes you to the hospital setting, and it puts you in a position where you can be noticed, where the manager can see you and consider you for that position. As long as you were diligent and you were a good worker, then you can definitely get that position. The other type of job is a nursing assistant, which is a CNA, right? Some people, they literally go from tier to tier. So they start off as a CNA, which is a certified nursing assistant. Then they move on to LVN, then they move on to RN. I didn't do that. I just went straight to RN. But the CNA, once again, is similar to student nurse intern. Just the title is just honestly just different. And the difference with this is that you do vital signs, you bathe the patient, you do all the same hygiene needs. You fix the bed, but you're not aware of what is going on, right? As far as like, why the patient has this procedure. You don't give meds, you don't do any of that stuff. But however, once again, you still see things. You may not know exactly why things are happening, but you still have exposure, you still have familiarity. Being a nursing assistant, honestly, it doesn't prepare you to think critically. That's what I'll say about that. It does not prepare you to think critically, but however, it prepares you for the hospital environment. It prepares you for the demand of the hospital. It prepares you for the role of nurses, but it does not prepare you at all to think critically, because literally a nursing assistant job is just task related. You're really just doing tasks, as opposed to a registered nurse. We have to think about, why we're doing this and so forth. So then, but a nursing assistant, you just do tasks. And then once again, you get paid. The average pay for a starting nursing assistant, depending on the state, can be $12 per hour or more, depending on the state. So some people like that because, it's more than minimum wage. The other thing though about being a student nurse about being a nursing assistant, some nurses, they actually stay being a nursing assistant. I remember I met some nursing assistants that told me like, yeah, I've been a CNA for like 20 years. And I'm like, I'm sorry, I'm one of those people where I just keep striving higher. So I never understood like, why somebody didn't want to like push, to the next level, because the segue is a lot smoother as opposed to somebody who was doing engineering or something, So, but anyways though, like nursing assistant, like it positions you once again for exposure, but you can't think critically, really. It doesn't really prepare you to think critically, and I remember I met one nursing assistant who actually told me like, yeah, I could never be a registered nurse though. I don't want to be a registered nurse. It's just not safe. It's just too scary. And I just think to myself, really? But you doing this though, don't you? Like when you're a nursing assistant, there's still a risk of exposure that you have as well, because you still have a risk of getting exposed to the patient's illness. You still have a risk of getting exposed to a needle stick, even if you're not, especially if you're not aware of your surroundings. You still have a risk of that. You still have a risk. So you might as well become a RN and get paid more, That's what I tell people. Like, well, you're still at risk technically, so you might as well get a license. Like, so anyways, though, like, that's what I would tell people. Like, those are the different types of jobs. So let me recap really quick. Nursing preceptorship and usually it's about 12 weeks, the nursing preceptorship. It's about 12 weeks, and then but it's not paid, but you get the most hands-on role as actually acting as a registered nurse, and it's the most marketable when you get a job, when you're looking for a job. Then the student nurse intern is paid, but you don't really do the work of a registered nurse. You just do duties and hygiene and that kind of stuff. And then the same thing with but the title is on your resume, so it looks good on your resume. And then finally, the last position, and then nursing preceptorship as well, is that it's usually incorporated in a lot of programs, but it's not available as an open position. It's kind of hard to get that type of role. And then finally, a nursing assistant, which is what a lot of people do, is you really just become a CNA. You just go to CNA school, which is like, I think I want to say like 8 weeks, and then bam, now you can have a nursing assistant certificate, and you just start working. But like I said, you just do tasks. You don't learn critical anything. But however, it exposes you to the hospital environment, so that way you're in a position where you look, the manager knows you because you were good in that role. So that's pretty much what it is, what the three the roles are. I hope that this was helpful to you. And just keep this in mind. Like I said, if you ever want to know more about this area or topic, just go to choosenursing.net and 2 nursing student jobs, and that's where it's located. And all my videos, like I said, they are on my YouTube channel, which is bit.ly/Choma TV, and the TV is capitalized. All right, so thank you so much for watching. Thank you to my replay viewers. You guys take care and have a wonderful day. Bye-bye.